I'm just going to briefly outline some of the psychological reactions that can happen to us in difficult times, but specifically, I suppose, in the context of the COVID-19 pandemic. It's really just by way of information, just to know what we might expect ourselves or in each other, really, as we go through this difficult time. Just firstly, some general remarks is that the mental health of doctors is no better and no worse than that of the general population. But the difference is that we have different coping mechanisms, often very positive and healthy coping mechanisms, but also we tend to rely a lot on denial and on really suppression of our mental health issues, mainly because of the demands of the job, but also it's part of our culture. But these are not necessarily good, and we need to, run up the white flag occasionally and just say we need a little bit of help. I guess the circumstances of practice in Ireland have changed in the last 25, 30 years, and the kind of comfort we had and the implicit understanding of our contract with the public has changed, and suspicion and mistrust has grown in that space. That doesn't help at times like this when we're being asked to do, very unusual and very difficult things. When somehow, the understanding of why we do what we do has been so badly damaged by so much adverse commentary. But anyway, the circumstances now are also, significantly less than ideal here as they are elsewhere. So we're forced to work in very trying and very difficult circumstances, often without, adequate protection or equipment or resources or planning. And, that's part of the circumstance now. I think we're doing very well compared to many other countries, but it's still very, very difficult, and a lot of real danger and concern arising from those circumstances. In terms of responding psychologically to COVID, there are a whole series and sequence of responses, none of which follow any particular pattern. So it's important to know that what we feel now will change, and we need to track and look after our responses over time. It's not all bad, of course. There are many positives to these kinds of circumstances, and I'll come to those at the end. And one of the questions we have in our mind is, where do I fit in this grand, theatre really of epic heroism and bravery and resourcefulness? And often many of us feel quite peripheral or inadequate, but that's normal, and we all have our task to play. Everyone doesn't have to be in the front line, and the front line needs a big squad behind it. So I think feeling somehow inadequate is quite common for many of us at this time. But also, the demands of this are going to throw up dilemmas and conflicts in our lives in regard to, where we fit within the system, public and the private, or frontline or not frontline, or retired or not retired, or what specialty we work in, and we're going to be quite conflicted in many ways. So we have to chat that over with somebody and try and work out a strategy to be at peace with our decisions in this. Lastly, it's important to say that in times like this, personal and professional, there are unfinished and unresolved parts of our life which can be thrown into sharp relief, and we can look at things with regret or panic and think, well, things we've missed out on, and things we haven't done, or things we regret, and these can intrude a little bit in our focus. So every life has those parts, so it's important not to dwell too much on all the uh, all the bits we'd like to have different in our lives, and just work now with the present. I guess the first thing I'd like to say is just that pre-existing mental health, if you have difficulties, can worsen at this time, and particularly depression can seem, you know, what can intensify, and obviously because of the difficulty of the circumstances, but also just simply with insomnia and stress, depression will worsen anyway. Anxiety obviously can intensify as well, and people with OCD like states can become, acutely distressed and very fearful at this time. So we have to allow for that. Ironically, sometimes they can also improve, which is really strange, in that in times of enormous threat, sometimes our psyche can recruit resilience and strengths that we didn't know we had. So it's not all bad. And their strategies, our coping strategies, will go from initial kind of shock and awe or panic and dread about what's coming to kind of a gloom about whether we're going to survive this or not, and then we kind of kick out of that and we sort of learn more and get stuck in. But those cycles can come back of panic and of gloom, and then of re-energization. So just to be aware and watch out for those, not to stay in one of them. And the traditional sort of defenses and coping mechanisms of medics, alcohol, prescribed or unprescribed drugs, street drugs, and so on, overeating or other addictive behaviors, all can intensify and seem justifiable in the circumstances. So we have to kind of watch out for those and make sure that doesn't happen, if possible. Just a little bit about anxiety states, which are, very common and very, understandable in this circumstance. And they're generally categorized under the umbrella of the acute stress reaction, which is really how humans respond to immediate threat. And they form into kind of clusters of symptom groups, not necessarily disorders as such, but they mirror the kind of disorders we see in mental health practice. So we kind of get generalized anxiety, but that can also tip over into much more intense and uncontrolled waves of anxiety, panic attacks, and intense or continuous or semi-continuous intense hypervigilance and psychophysiological arousal. We can also disconnect at the sort of extreme of anxiety. We go into kind of depersonalization states when everything seems unreal, and that's a common reaction in circumstances of extreme threat. Another common anxiety type reaction, as I've already mentioned, is compulsive and OCD-like states. So this when the HIV story started to evolve when I was a young doc, and you can see doctors who get needle stick injuries or imagine they have become infected or could become infected, and then imagine they are infectious, or don't believe test results, or start checking, washing, avoiding, can completely intrude on your mental peace and composure and affect your practice. So that's not uncommon in particularly infectious disorders, and something we have to get help with, because it's very difficult to manage on your own. Not something to be ashamed of, worrying that, what I can't really, why am I worrying when my test is negative? And trying to say that to a colleague who's trying to reassure you can make you seem foolish. So we tend to cover up and hide those kind of worries. Another thing I've seen, one can see here, is catastrophic reactions. So you can go, if you like, into complete meltdown psychologically in the middle of your working day, and absolutely lose your composure. You will see that, and one does see that, and it's very distressing. And people need special care and need minding if that happens. Need to be reassured that, of course, they can come back to work, and nobody will think any worse of them. But they can be explosive and angry and quite difficult. So just to expect those, and to make sure that the proper care is applied afterwards. As the sort of story unfolds and the phases of the pandemic evolve, so too do the mental health reactions, and we kind of get sort of mid-phase reactions now, when things like exhaustion start to take their toll. Insomnia, is very, very debilitating, and that trends, long shifts and very, very difficult clinical scenarios, leading to emotional kind of just complete being overwhelmed and distress, crying uncontrollably, and they are common and entirely normal, but need care. We can see psychic coarsening when people can get very dark in their humor and very, very, sometimes unprofessional in the language or the ways they communicate, and we have to guard against that, because it's common, but it's damaging to our long-term standing and practice. We also see ethical and moral distress as people are trying to resolve the irresolvable, really, in terms of the mismatch between the reality and the demand. So we have to seek the guidance of colleagues to try and work within our own, if you like, conscience to make sure that we're right with our decisions, or that we can live with them. Another mid-phase reaction, as I say, is a kind of depersonalization of oneself. You just switch off and go into and you can't come back, is the problem. You can't come back into a kind of a real, normal, ordinary feeling state. You tend to shut down emotionally. That can be very difficult. And even switching between states can be very difficult as well. Trying to be one thing at work and then transform as you come home is a very difficult switch from intense activity. So you really have to see if you can find ways to help unwind before you kind of open the door on your home life. But you also see dehumanization, when people start to seem, just like less than people, and we somehow start to blame or disconnect really from the humanity of the people who are suffering in this way, or start blaming people or different categories of people and so on. We also see splitting and projection, where you kind of, there are good people and bad people, there are good administrators and bad administrators, there are good hospitals and bad hospitals, etc. So blaming through projection is very common as well. We just simply get very, very agitated about how things are, and we tend to put them into categories that are not perhaps as reasoned as they should be. Another thing we see is risk-taking and escape behaviors, and that's really just kind of playing with fire, really, in the downtimes, or even at work, where we indulge in behaviors that are potentially injurious, or certainly possibly harmful to us, or we just seek escape in some kind of unhelpful and pathological activity, which is again something we're better off trying to avoid. Lastly, you can see brief elation episodes, people who, through insomnia or through underlying vulnerabilities or dispositions that are revealed in a crisis, you can see brief periods of hypomania and elation that's pathological. I certainly have seen those, and we need to recognize that these are seriously pathological in our colleagues or in ourselves, and they need proper professional care. We can get over them relatively quickly with good care, so it's important to get that care soon. Lastly, then, are the later phase reactions of post-traumatic and depressive, really, and these are when we kind of get into gloom and self-blame or guilt or regret or shame about some of the things that have happened or that we've had to be part of. And also that kind of sense of powerlessness and hopelessness and futility can pervade our thinking and really dominate, and imbalance really the actuality of how the world is. Obviously, there's compassion fatigue, which was that clinical descriptor began in ICUs when nursing staff just had nothing left inside in terms of feeling to give, and we need to take care of that and stand back and refill the tanks. Burnout is that sort of compassion fatigue on top of overwork and systemic factors that completely flatten us. Again, that requires time out and care. Depressive reactions I've really already mentioned, but one aspect, and we've already seen some of this internationally, where there are suicides in healthcare professionals who just get caught up in circumstances and see that for some reason suicide is something they should do because of the circumstances they've witnessed, or things they have been blamed for, or things they've regretted, or some very harsh judgment they've made of themselves. So it's really important to guard against suicide and to watch out for people who just are showing the signs of just increasing and spiraling gloom and despair. The trauma-based responses of PTSD and so on are really another subject, but we do see those from people who have seen and done things that they never imagined possible, good and bad, but that there isn't time to process these, and that can leave you with kind of long-term avoidance behaviors and triggered memories and flashbacks and depression and all sorts of intrusive and highly disruptive sequelae to traumatic experiences. So we don't have time to go into that, but that's something that'll happen much after the acute phase, and we need to make sure people recognize that and get the help they need. On the positive side, often times in circumstances like this, we have more time to reflect and figure things out and reappraise a lot of things in our lives. So it gives us and forces us, if you like, invites us to reappraise everything. It's often a time of great growth and learning. We're all getting CME by the new time in terms of learning a lot. So it's a time of great professional growth, and we acquire new skills and grow a lot in this. So that's very positive. Also, it's a time of surprising intimacy, in terms of we can come to appreciate our beloveds more, spend more time with our family and pets and all of that, and a sense of connection, with our wider families and the community. It's a wonderful feeling. Fabulous collegiality and friendship in terms of we hear from and we reach out to colleagues across the globe who we know will be in hot seats, and they come back to us, and we it's a wonderful resource that medicine derives support from. Sometimes there's a reappraisal of our priorities, and we can see that, well, maybe we're spending too much time or not enough time doing this or that, and we should really get back to doing that thing we've long deferred and put off. So it's a good time to have a look at that. Time of great creativity and discovery, just in one's personal life or professional life. One can see and do things you didn't know about, and find talents and interests that are very rewarding and uplifting. Sometimes there's a repurposing of our life and our recommitting. We discover why we're doctors again, and why we did what we did, and how invigorating and purposeful that is, but we also discover that, maybe this isn't for us, and that, there are other things in life that you need to devote your time to. And it's a time of possible reinvention when people can really see that, jeepers, I really like this acute stuff, or jeepers, I really like this or that. People can change direction and, go into research or go and do something they never really had the confidence to do before. So there are a lot of positives, and I'm not trying to gloss over the difficulties, but it's not all bad. Long story short, it's very important that we all look out for changes and difficulties in our own psyche, recognize them in ourselves and in others where possible, and encourage and reach out to people and ask them to reach out to others who are available to support. There are many places now one can take one's troubles to, and they're widely publicized. So I encourage everyone to do that if needed, and help others if you don't need yourself. So that's it. Take care, and thanks to everybody for what all they're doing. It's a very proud moment to be a member of the medical profession, I think, and the healthcare profession generally. So that's it. Take care.